I'm happy to be here. Thanks to everyone who's attending, and you can go ahead and kick it on to the next slide. We're specifically going to talk about a little bit how fines and fees are kind of a hidden barrier to finding and maintaining stable housing. I know that a lot of people are kind of reluctant to touch the fines and fees area because it can be considered something that's quasi-criminal, and a lot of us stay out of the criminal defense realm. But as part of providing holistic legal services through a medical legal partnership, addressing these outstanding fines and fees and these outstanding municipal matters is absolutely crucial to ensuring the stability of our patient clients, not only in the housing sector, but also in every other area of their lives. You can go ahead and advance to the next slide. And once again, also I'm an Equal Justice Works Fellow, as Bethany said, and I'm sponsored by Covington and Burling and Merck. And go on ahead. So our context is that we're coming from the complex care field. So this is a little bit different in that we're actually an MLP without walls. We're not linked to a hospital or a clinic per se, but rather we align ourselves with the Camden Coalition of Healthcare Providers that is providing services to individuals out in the community. And so we truly believe that complex needs require complex approaches. And the blueprint for complex care includes person-centered, equitable, cross-sector, team-based, and data-driven. And we apply this in our legal services as well as in the other services that we provide. Go ahead and hit the next slide. Thank you. Basically, we've layered our legal services upon a pre-existing complex care structure. So we use these person-centered principles such as the coach model, which involves coaching individuals, helping look at their long-term plans, their own priorities, observing where they're already coming from, and visioning what they want their lives to look like and kind of working back from that vision. We also employ other principles such as harm reduction in our approach. And the equitable sense, we're always thinking about systemic approaches, the bigger picture, and the disproportionate impact on people living in poverty, people of color, in everything that we do. Cross-sector or multidisciplinary. So I'm not just an attorney that people get referred to, but I'm a member of the care team. I work alongside nurses and social workers and community health workers, and they all participate in supporting the legal work that we do as much as I'm participating in supporting the medical and social work that they're doing as well. And it's team-based, so we're constantly teaming and trying to figure out things together. And data-driven. So from the patients who are selected to participate in care interventions onto what we advocate for and when, it's all based on data-driven. And I see someone asked about defining the coach model. You can go to camdenhealth.org for that coach model, and there's a lot of good information about that. Next slide. So some of the common housing issues our clients face are probably ones that most of you are familiar with. So lack of income, credit issues, legal history that prevents them from finding good housing, the accessibility of units. So if you're working with individuals with a lot of physical health needs, they may need a downstairs unit, they may need something that's wheelchair accessible, the general location, so something that's close to public transportation, close to their doctor's offices, things like that. The usual habitability concerns, so whether or not the units are actually livable. Conflict with fellow tenants or landlords, that's more of a preventative issue. So when someone is already housed, that's something that may jeopardize their pre-existing housing. And then prior utility debt, so the ability to actually turn the utilities into their name once they move into a unit and get those activated. Next slide. So in a complex care context, specifically when we're using wraparound support for housing, we really want to engage the entire team to address barriers to housing, both to getting it and maintaining stable housing. We're actually lucky in that we have an in-house housing first team. So not only are we working really closely with our community health workers, our social workers, and our nurses, but we also have housing experts. And this is really helpful because it can give us a better idea of what sort of qualifications are required for specific housing programs. And it helps inform our legal advocacy then, because we can help steer people towards better outcomes that are better for them legally, but also better long-term for their housing prospects. We also recognize that everyone has their own expertise to contribute, and especially the patient. So one good example with housing is that we may think that an apartment complex is going to be the absolute perfect fit for this patient. But if it's a location where they previously were engaged in active substance use, it's their hometown, it's something else involved, it may not provide them with the best success. So just remembering that they have their own expertise to share and that should really be driving the decisions that we're making. cross-sector collaborations are really helpful with housing as well. And so we're able to provide the documentation that we need. For example, when we're looking for accessible units, we're able to provide the medical documentation that we need. When we're talking about reducing those barriers, we're able to provide documentation to the court, things like that. And we're able to pick up on trends and then do larger scale advocacy. Next slide. So fines and fees themselves may not seem to be an intuitive barrier to finding and maintaining housing, other than the fact that if you're paying lots of fines and fees, you don't have the money to pay rent. But there are a lot of other collateral consequences as well. So certain housing prospects may be totally off the books if you get certain charges. So advocacy on the front end to help mitigate those charges and get them downgraded is really helpful. Incarceration is a risk in states that have incarceration for non-payment of fines and fees. And we know that people with complex health needs, incarceration is actually a really huge risk, especially during a pandemic. Even if it's just for a few days, it's very risky. Damaged credit score is always a concern. So if you don't pay your fines and fees and then it's eventually sent to collections, that's going to be an issue. And the collections rates are really high as far as interest goes. Loss of driver's license. So in the majority of states in the United States, you can actually lose your driver's license for non-payment of fines and fees and or failure to appeal for municipal offenses. Payment plans impacting your budget. So if you owe $5 here and $10 here and $100 here a week or a month, and that ends up adding up and you have a lot less income to be able to find housing and pay for it. And then also the stress of outstanding matters and fines and fees. This is one that our clients identify most, that they have this huge burden looming over their heads. There's a warrant out or there's something involved with that. There's money that they owe and they're just constantly feeling like this is a huge stressor. And when they're in their recovery and they're kind of progressing well along that way, it can be something that holds them back. Next slide. So how do we encounter these issues? It's interesting because when you have a fines and fees issue, a client may have ones that are all over the place. So they may have matters that were never adjudicated, ones where they received a ticket or they received a summons, never went to court, still open, it still needs to be addressed. Then you could have ones that are post-conviction and they have lots of different states of imposition. So they didn't have a payment plan and they still have to make one. They made up a payment plan, but they lapsed on it. They didn't pay it and now it's in collection. So the financial aspect can be all different. They may have outstanding warrants that need to be addressed. And it's really hard to find a clear picture of what exactly is going on, because in some places when you're searching for the warrants, you're going to get different information, whether you put in the person's middle initial or not. You're not going to get all of the information. It's really hard to get an accurate picture. And if you have an outstanding warrant or you think you might, going to the courthouse and asking for their internal systems printout of what your open matters are is not the best idea. So that's one of the biggest challenges they face. Next slide. And why is this issue hidden? So when we first did a legal needs survey to begin the medical legal partnership several years ago, it actually wasn't something that came up. Fines and fees and municipal court matters never came up. People identified housing, they identified benefits, they identified other priorities, but not the fines and fees. But when we started providing actual MLP service to clients, that's what started coming up. That was the biggest barrier. That was what people were getting locked up for. It wasn't these big offenses. It was, the jaywalking tickets and things like that people were having trouble with. And so a lot of people perceive tickets and ordinance violations as not being a legal issue sufficient of assistance or of representation. And a lot of our patients have actually incurred all of these legal matters over the course of many decades or many years while they were in active substance use. So they really can't keep track of what they were doing when, where they got tickets from. And because they're moving around a lot, they have difficulty receiving court mailings and staying on top of things. Next page. So for a complex care approach to fines and fees, we specifically at the client level help the clients assess, address, and prevent fines and fees issues. I often say it's a lot like whack-a-mole. I feel like when we get rid of one warrant, another three pop up. It's important that they get an accurate picture of what they're exactly dealing with, and it's really difficult to do that, even for us to do that. Like we have our own workarounds that we're able to get an accurate picture from the courts directly, but your average person isn't able to do that. And so a lot of our advocacy is geared towards trying to figure out how we can make that more accessible to more people. Then you want to help the client triage and schedule their hearings. So you want to make sure that you're able to help them triage, not only from a legal perspective, okay, this is the highest priority, we're getting rid of this active warrant, but also from their perspective. So maybe there's something about the locations of the various fines and fees or the warrants that they really want to take care of, their hometown while they have the support of the care team, because that is most triggering for them. You want to incorporate time payments into the client's budget and help them in assessing their ability to pay prior to the hearings. So the ability to pay portion of the hearing is actually, it's pretty stressful, it's pretty quick. And if you don't have a good picture of your finances going into it, you're not really going to be able to give the judge an accurate idea of what you can actually afford. And then supporting the client and accessing hearings is really important too, especially with virtual court. A lot of our clients do not have any sort of access to a smartphone or any way to do Zoom, and that's how court is happening in New Jersey, at least right now. And so it's important not only for virtual court, but when it's in-person court as well, to be able to provide assistance during the court hearings themselves. Next slide. The court level is another way that we've had some really good success. So the important thing is providing the context. We're providing context to humanize our clients and to make sure that the judges and the staff at the court and the public defenders and everyone know exactly what's going on in our patient clients' lives to be able to provide the best outcome for them. So a lot of times, if these are really old matters, we are calling and scheduling them. Our client wasn't found, they weren't picked up. They are proactively going after these old fines and fees and old open matters to be able to continue along the process of healing and recovery. So we want to make that known. We often have to call and advocate for removing a warrant when we call and schedule a hearing. Some courts will say, well, you have to turn yourself in and pay bail first. Our clients don't have that money, they can't do that. So providing the documentation as to why they can't do that or what stage of recovery they're in and how this is part of how they're trying to rehabilitate themselves is really important. We want to be involved in mitigating the impact of the charges that they receive. So providing some information, especially if it's from a housing first provider, about what would kick them out of the program, what would make them ineligible for the program, and trying to get alternatives proposed that don't jeopardize housing. Bearing in mind that sometimes the more municipal ordinance violation type charges will have higher fees associated with them, even if they are considered a lesser offense. So you want to also try to help negotiate on the fees issue as well. And once again, you're going to explain the client's progress. You're going to explain the posture of the case. If they scheduled it on their own, that's really important. They're taking care of their responsibilities. They're owning what they've done in the past. Provide creative solutions for community service. So we've actually been able to get people credit for participating or facilitating groups through organizations. If they are a peer mentor, if they provide speaking engagements as a peer recovery specialist, anything like that, providing alternatives to the judge to convince them that this is a viable option. This person is already giving back to the community. They should receive credit for that. And then using a positive change in housing or in other circumstances like their income as evidence of unlikelihood of reoffending. So if someone was stealing because they had no income and now they have Social Security and they're going to be able to provide for their basic needs, they're no longer going to be able to shoplift. They're not going to be interested in shoplifting at Walmart because they were just looking for food. And that's really important to provide that context in humanizing our patient clients. Next slide. So then at the systemic level, it's important to kind of familiarize yourself with the opportunities that are already going on in your area or state. So look for existing local efforts surrounding municipal court issues and fines and fees. New Jersey actually, the Supreme Court presented a municipal court report that happened to co-align with the beginning of my fellowship, which was really exciting. And then the effort seemed to slowly dwindle down. So unfortunately, you kind of have to strike when the iron's hot. You have to see what's going on. And you want to look for existing efforts so that you don't have to reinvent the wheel. Maybe you can provide some really reasonable context or some really interesting information to either lawmakers that are involved or other advocacy organizations. Provide the client's voice and explain exactly what the impact is. If you're a medical provider, you can really provide that context of, this is why my client needs to be housed. This is the status of their recovery. This is how they're doing. And provide that information that shows that this is what's holding them back. You want to build and strengthen cross-sector relationships as well, because we really want to highlight the broad-reaching impact of fines and fees, especially in the driver's license arena. This has been really successful, kind of collaborating between all of the various factors. Driver's licenses are important to finding housing, but also jobs, also getting to medical appointments, getting to school, things like that. So there are a lot of interesting collaborations and coalitions that can form just around the area of advocating for driver's license suspensions, for example. And you can look to leaders in fines and fees work for resources as well. So the Fines and Fees Justice Center is really great. There's a lot of other folks out there as well that do awesome work, but they can provide some ideas and look to other states too. So see what other states are doing. So New York just signed a bill that will change the way that they were doing driver's license suspensions. So now they're not going to be doing driver's license suspensions for non-payment of fines and fees. They're reinstating a ton of other people who have already had their driver's license suspended as well. And there are some other provisions in the bill that's great too. So it kind of gives you a little bit of a model for what's going on. Next slide. Thank you. That is all I have for that. If you have any other questions, feel free to let me know. And yeah.
That's great. Actually, a couple of questions did come through. I'll note a couple of things. One question was looking for resources on really the history behind or housing instability or homelessness. So for folks that are looking for that sort of body of literature and research on housing instability, homelessness, or even if it's not housing instability, perhaps it's about housing that really is, I'm sorry, I'm just at a loss for words, but I'm thinking of like I'm just at a loss for words. This is multiple days of presentation. But perhaps you're in housing that really is effectively uninhabitable. Not the word I was looking for, but that is in fact the effect. So we do have on our National Center for Medical Legal Partnership website, a section where you can actually type into the search box and look for resources specific to housing. In the welcome packet, however, for this learning collaborative, we did actually pull some of those documents to share with you all in advance. We know that not everyone clicks on everything or is able to read through every issue brief, but if you are interested in the housing research or housing instability research as it pertains to veterans, I would go to our website and definitely look at the veterans related issue briefs. And we also have, and did put in the welcome packet, links to more housing specific issues. There is a specific question in here. Ashley, I believe you pointed folks to the website about the coach model. You want to highlight anything more about the coach model though?
Yeah, so I just want to say that it's basically, I kind of explained how it works in practice, but the idea is that it's client oriented, it's client centered. You're kind of observing what they have going on from the start and helping them kind of vision what their future might be like. And then you go from there and work backwards. So that's the most important thing. And it's something that can be applied to medical goals, legal goals, social goals, any sort of goal. But you're kind of positioning yourself as this coach, you're coaching them through it. And the most important thing at the end is that you're highlighting the progress. So especially when I was talking about fines and fees feeling like whack-a-mole, a client can get really frustrated that we've knocked one out and then there's 3 more that show up, or they get behind on another payment and they have another warrant. So just highlighting that progress along the way. The good thing about fines and fees is they're actual numbers, right? So you can say, you owed at the start of this $8,000, you owe at the end of this $200. And that's really tangible and that's really good. And it may feel frustrating when you feel like you're not making a dent on those fines and fees and they're paying $200 a month to 8 different courts. But it's important to highlight those goals. I did want to say one thing too that I didn't really explicitly address, and that's that fines and fees disproportionately impact our clients and patients of color. And they really do, and people living in poverty. And this is one of the issues, is that we are using municipalities and different counties and things are using fines and fees to specifically supplement their budget and pay for governmental operations. When a lot of folks are trying to tackle it from a policy issue, they thought initially driver's licenses are a good thing to tackle because everyone wants their driver's license back and everyone can tangibly see that, but people want to make sure that there's some sort of penalty for not paying your fines and fees. And so we need to keep the fines and fees themselves. But a recent study that came out, I believe in around December, of roughly 1,000 bipartisan individuals found that actually the majority of Americans during COVID are in favor of suspending fines and fees collection, but also are more in favor than you would think of just removing or reducing them altogether and replacing them with alternatives. So especially when we consider the systemic issues with policing and targeting other communities specifically, there may be a lot more support behind it than we think.
I'm glad you mentioned that because we are hearing increasingly from medical legal partnerships, as well as others in the social determinants of health space, looking for ways to really tackle racial equity issues head on. And often I come back to the just point blank statement that, in fact, this is what we're working on. Perhaps we need to be a little bit more explicit about getting to that outcome. But this is, in fact, what, as poverty lawyers or social medicine or social workers and the various professions and disciplines, this is why we work on the social determinants of health. It is to ultimately impact various types of disparities and disproportionate impact on certain races. In other cases, you can then take it across to gender, and then the broad swath of people who go in and out of poverty or are stuck there for far too long. So I appreciate you bringing up exactly that point. Those are the sorts of points that we're hoping to really bring out in our discussion. So thank you, Ashley.